Today we have Noha Khater, CEO and co-founder of Almouneer, a network of digital eye care clinics based in Egypt. Noha, thank you very much for joining us. Almouneer has come a long way since its founding in 2014. Can you tell us a bit about some of its biggest milestones in the company's history since founding?
So one of our biggest milestones, I'll start with a few. One of our biggest is actually when we were able to pay off our CapEx and the starting expenses in a very short time. It took us about a year and a half. And that has proved the profitability of our model. We were then very eager. We trusted our model and were very eager to expand. The second milestone, at that point, we had a big devaluation in the Egyptian currency, and we couldn't finance the CapEx for the expansion, and we were able to secure an SME loan, and that was our second milestone. This SME loan enabled us to finance our expansion. And then Almouneer was chosen as an Endeavor company. Endeavor is a very big, famous business network that has supported us through mentoring and coaching and helped us design our business model. In 2018, I was chosen as a finalist for the Cartier Women's Initiative Awards, and that's also considered a very big milestone. And Cartier has provided a lot of business coaching and mentoring and has helped us look at our business in a very broad and interesting perspective. And through the Cartier, I got a week at INSEAD at the ISEP, at the Social Entrepreneurship Program, where I got to come to INSEAD and meet professors of strategy, Professor Itai and Elsa. And this is finally our last but not least milestone, where we became the company chosen for the Master Strategist Day, which we considered the biggest milestone so far.
How do you characterize the mission of Almouneer, and how do you see the company executing on this mission over the next decade?
So Almouneer's mission is to prevent blindness from diabetes. One thing we promise our patients is that they will never go blind from diabetes and they become sightful for the rest of their lives. And we achieve this by opening as many branches or as many clinics throughout Egypt and hopefully internationally to enable us to achieve this mission.
Tell us more about the NGO that's affiliated with Almouneer. What is the role in helping you deliver your mission?
So when Almouneer started, one of our main pillars or focus of our work was to increase awareness about diabetes and the effect of diabetes on the eye. We used to go on a lot, and we still do, a lot of campaigns to raise awareness. We go to social clubs and gatherings and a lot of corporate companies to raise patients' awareness about diabetes and also to screen patients for the disease and the effect on the eye. We were faced by a problem that a lot of these patients, when we discovered that they had eye problems, had no access to treatment. The public healthcare sector in Egypt is defective, and of course the private sector is unaffordable for a lot of patients. And hence we came up with the idea of the NGO. We wanted to provide healthcare for the people who had no access to healthcare, and we're able to raise funds for that cause.
What are some of the challenges of operating a commercial model alongside a social model, particularly in terms of the design of the organization and how you approach the growth strategy given these two objectives?
So we consider Almouneer as a hybrid organization. We're clearly a for-profit organization that has a social mission, and we want this to work alongside our non-profit part, which is the NGO. So we have challenges in infusing the passion of the founders in the people who work with us, to prove that profitability is not just for the sake of profitability, and that this profitability is very important for us to deliver the social mission and to make sure that our impact is wider and not just restricted to patients who can receive the treatment at the for-profit organization. So one of the main challenges is to work with people who have the same passion and who believe that the mission of the company is not just profit, but also to deliver social impact all over the sectors of the society.
Have these challenges that you've outlined here been exacerbated by operating in an emerging market?
Actually, working in an emerging market has proved to be a benefit. There is room for growth, for innovation in emerging markets. I mean, there is always ideas that you can implement because there is clearly gaps that need to be filled. A public sector that is defective, a private sector that is only focused on profit and not focusing on social mission. So this has given Almouneer space to design and come up with an idea that can deliver a for-profit organization with a clear and obvious social impact.
So how important is competition and strategic direction when you have a social mission?
Well, competition is very valuable, whether you have a for-profit or a social mission. it's always a driver for growth and for innovation. And also strategy is very important. I mean, developing a strategy for the NGO and developing a strategy for growing our social impact has been proven to be very important to deliver the value that we want to deliver. It's not just something that's restricted to for-profit business or regular organization. It is definitely something that is even, I consider, more important, because with nonprofits or with social missions, you have to come up with ideas that are outside the box and create ideas that will create an impact through very limited resources and in very challenging markets.
What are some of the organizational factors, such as Almouneer's business model, its resources, and its capabilities that enable or constrain the company's future growth?
Well, so far we've had enablers. We've had enablers by working through a very standard model, through using technology, and through working with a very highly professional team. The vision we have as co-founders for the future of healthcare in Egypt, for delivering a quality that is affordable, that is standardized, and for scaling. All these enablers are through government support. We've received an SME loan from the government, from the ecosystem, from the entrepreneurial ecosystem, like support from organizations such as Endeavor, such as Cartier has been very, very helpful. Even coming here at INSEAD and meeting professors, I mean, professors of strategy, Professor Itai and Professor S, and the help they have offered us. This has all enabled us to clarify our vision and to have a clearer vision of Almouneer and how to grow it and to deliver its social impact. Regarding the constraints, I mean, one of the major constraints that would face any business that's trying to strive and to grow and to deliver an impact would be mainly funding. I mean, having creative sources of funding, that's always one of our challenges, and also talent retention and talent acquisition and retention. We want people that are inspirational, that share the passion and have the same vision that we do.
How important are ecosystems in which Almouneer is embedded? We often think about the healthcare system as an ecosystem of interconnected stakeholders, such as partners, suppliers, regulators, private and public payers. So what impact do these players have on your business?
Well, actually, Almouneer exists in a wonderful ecosystem. I would say I would start first with the business ecosystem. We've got support from everybody around us. We've got support from government supports through the SME loan. We've got support from professional networks such as Endeavor. We've got support from the European Bank, the EBRD. We've also got support from Cartier and from INSEAD. So the business ecosystem here has given us great support that has helped us establish a vision and a clear vision for Almouneer. Also, we have a very strong social ecosystem. I mean, the NGO is built based on our social connections, through our network of friends that have helped us raise funds, that have believed in our idea and our the value of the thought of improving patients' quality of life and people's awareness about their health. About the healthcare ecosystem, I can't say it's as developed as the other ecosystems. I say it needs more work, because right now major healthcare players, whether they are the government, are still focused on fixing their own internal issues. And at the same time, the private sector is focused on working as sole players and working as competitors rather than working together to improve the whole entire ecosystem. So I would say that the healthcare ecosystem needs a bit more work to flourish as other, like the business ecosystem.
As you think about Almouneer's future expansion, what are some of the macro level factors, such as government policies, demographics, economic trends, that you feel would enable or constrain the company's future growth?
So for Almouneer's future expansion, we look at the macro level in several factors. First, regarding government policies, we have not had any restrictions so far, and we've just received support from the government. We've been approached by the Minister of Investment, and she has shown great admiration of the business model that we have and offered support. We have been approached by the Egyptian Social Fund, and they provided us with the loan. So the government has been supportive so far, and we're actually looking forward to the new Egyptian healthcare insurance law. And I believe that Almouneer will be working with the government on this aspect to deliver quality and affordable healthcare to the entire Egyptian population. Regarding other constraints, I mean, we don't have right now any constraints in terms of regulation. In demographics, we study demographics very well in terms of our future expansion, where to place our future location in terms of patients' needs and accessibility. And as regards the economic conditions, we're very well aware that Egypt is passing through a lot of economic constraints. We had the devaluation 2 years ago that has affected the entire population, and that's why we have shifted Almouneer's future expansion into low-cost, affordable models so that we can access as many as the population as we can.
As you scale, how do you ensure that the growth does not affect the quality of the services you're providing to patients?
We work on 3 pillars, Ridhima. We work on 3 pillars. One pillar is training. We make sure that we invest heavily in training. There is a subsidiary of Almouneer called Almouneer Research and Education. We make sure that our doctors are well trained, our nurses, our optometrists, our staff. So training is very, very important for growth and scaling. The other thing is auditing. So I was once talking to the CEO of a very famous company, and he said that he audits his data and looks at KPIs every day and assesses the performance of every individual, every doctor, every nurse, like takes feedback from patients and takes feedback from everyone every day. So we audit. And also we reward. Our third pillar is reward. So we make sure that our staff and everybody who works at the organization is well rewarded. And that's not just financial reward, but also by accessing like prestigious scientific events, like a nomination for certain rewards, so that they feel that they're appreciated and their growth goes hand in hand with the growth of the organization.
So you've talked about Almouneer's vision, but in terms of your customers, particularly from the patient's perspective, how does Almouneer improve their lives and address their needs?
So Ridhima, Almouneer was based on addressing patients' pain points. I was a practicing doctor, and the first Almouneer was at my own private clinic. And I remember that patients were always concerned about several things, like coming to the clinic and then going to the hospital to perform certain tests and then coming back again and then going to the hospital again for treatment and then coming back for follow-up. So these are all customers' pain points, and they were concerned about the traffic, and they were concerned about whether any members of their family are going to be available to drop them off at the clinic. So when we started Almouneer and we made it a one-stop shop for everything, like the patient would come in the morning, have all their tests done, receive their treatment, and head home just in one visit. This was addressing the pain points of the patient. It's using what we have and the means that we have to make patients' lives easier. At the same time, we focus very much on the emotional status of the patient. It's not just that we're providing high-quality service or it's based on technology, because these are enablers for the service. Of course, the patient appreciates them and appreciates the value of the service. But we also focus on the patient, as a human being, as the impact of how the disease impacts their lives and their psychological well-being. We have patients that schedule appointments together because they come and socialize together. And we have patients that appreciate very much the reminders. They feel as if we're sending them a personalized message to bring them over to our clinic and maybe ask them a few questions about their families, about their diet, how well they're doing for their blood sugar control. So these things are very, very important when you deal with patients and you touch upon their lives. They appreciate the service, and it makes them more connected with Almouneer and believe very much in the mission that we are sustaining.
How do you define your target market, and what are some of the ways you identify patients that would most benefit from Almouneer services?
I would say our target market is every diabetic. We have 12 million in Egypt. We have 39 million in the region, and we have 425 million diabetics worldwide. These are the patients that we want to reach. We want to reach each and every patient at different levels. We want to raise awareness. We want to prevent blindness from disease that is highly preventable just by increasing awareness and doing regular checkups. How we base this market, how can we reach it? We've reached it based on several ways, based on experience over the years that I've seen what the patient needs and what drives them to come to our service. Also based on marketing surveys. We constantly survey our patients. Every patient that steps in at Almouneer is asked, where did you come from? What made you come to our service? And what made you want to check your eyes? These are very important data that we look in and analyze so that we know how to drive our patients to our service or to any service that would make them improve their health and save their eyes.
What are some of the alternatives to Almouneer? Are there certain patient segments that would be a better fit with other providers?
Of course. We believe very much in collaboration. I mean, Almouneer is focused on certain eye conditions, like patients suffering from chronic eye problems such as diabetes. We receive a lot of glaucoma patients, a lot of age-related macular degeneration, retinal vein occlusion. But there are certain specialties that we do not treat. And I'm sure there are people who provide better care than us in these terms. So we provide, for example, we don't provide pediatric eye care, so we refer them to more specialized centers. We don't provide oculoplastic eye care, so we send them to other specialized doctors. So there are certain specialties that we don't cover, and we believe very much that there are people who would do a better job in this perspective than ours.
What are the drivers of profitability of Almouneer? How do you think these will change given your growth plans?
Well, the drivers of profitability of Almouneer is basically seeing more patients. The Almouneer becomes very profitable if the patient volume that we receive increases, especially if they are lifelong patients. Here we are treating chronic patients, and chronic patients have a high lifelong value because they are repeaters. They come every month, they come maybe every 2 weeks for treatment. So if we increase our patient bases and we have accessibility to Almouneer and its services, I believe this will drive the profitability of the Almouneer tremendously. And we ensure this through several marketing channels. We ensure this through increasing awareness, and this is how we ensure the growth of our organization. This is exactly why we have a very aggressive growth plan. We want to be accessible. Convenience is key in healthcare. I mean, patients don't want to travel for long distances or get into transportation, whether it's public or private transportation. They want to go to a service that they trust, a service that is affordable and is convenient for them and accessible. And that's exactly what we're planning to do.
How does Almouneer interact with patients? Does the interface involve in-person interactions or the use of technology? And how is this different from other providers?
Well, Almouneer focuses on the patient experience. It's not just a regular clinic where you go get your eyes checked and leave. We implement technology from step one. The patient goes in, he sees his data on the system. He can review his tests on a big screen, and there is a personalized interaction. So we know his last blood sugar, the last time he came to our clinic, how well he was doing, and the progression of the disease, and maybe a few personal questions about his own personal life, and if he's had any issues regarding his general condition or the family members or anything. So we focus on the patient experience. We want the patient to feel that coming to Almouneer is not like any other healthcare provider. That is a personalized system, and this is a system that cares about you, and our aim and target is to make you better.
How have you used technology to improve your internal organizational processes?
So technology is our main pillar. Starting from the moment the patient enters our service, they're registered at the reception through our software, and then the nurses and the optometrists record the data on electronic medical records, and they walk around with tablets. And then the patients are seen by doctors. The doctors input the data on our software system as well. And all through those steps, the patient can see every point and every data that's entered on the system. And then the diagnostic testing are all hooked up on our electronic medical record system. And this ensures that we are totally dependent and reliant on technology.
Would you characterize Almouneer as a focused service provider with a specific mission that is known to everyone, or more as a general solution provider?
We are a focused service provider. We have a specific mission. Our mission is very clear. If you go on any website or any social media for Almouneer, our mission is to prevent blindness from diabetes. It is a shame that in this time or era that any patient should go blind from diabetes. It's a very clear mission. It's a statement. And this is what we're focused on, and this is the message we deliver to everybody, including our patients and everybody around them.
We very much appreciate the opportunity to learn about Almouneer and to bring some of those learnings into the INSEAD's MBA classroom. What has this experience been like for you in terms of engagement with a business school?
Well, Ridhima, this is a once-in-a-lifetime experience for us. Being with INSEAD, it has been like a game changer. During the past few months, we've worked intensely on our business plan. We've worked on our financials, our vision for the growth. And one of the things that were always like on our mind and was very challenging for us is how to incorporate the for-profit business with the social mission. Coming to INSEAD has clarified our vision for that. We have a clear idea now of what we want, where we want to go, and how to achieve that. And I believe this wouldn't have happened without coming to INSEAD and being with you.
Great. Thank you.